To check for pelvic instability, there is no blood work, there is no imaging. What ends up happening is we look for clinical history and an examination. In my practice, treating pelvic floor dysfunction, I can tell you that that exam does not include going in through the vagina and or anus to check the status of the muscles inside your pelvis. After all, this, how far do you think that's going to get me? How far am I going to go in to access the depth of the muscles inside your pelvis? In this video, I'm going to explore different things that I look at, and at the end, I'm going to show you some of the exercises that I recommend to my patients that I find to be helpful. First of all, when it comes to pelvic floor dysfunction, we need to ask, why is it dysfunctional? Dysfunction happens as a result of pelvic instability. So just bear with me. Your pelvis is to be stabilized. It's the foundation to the structure above. When the muscles on the inside, which is more than the floor, but the walls are included, they work with the outside to stabilize the pelvis because that's the foundation. When the stability on the outside, within the pelvis, the three bones in the pelvis and what's connected to it, which is your spine and your lower extremities, when the stability is compromised, the muscles inside your pelvis have to make up for it. That makeup means tension. And that makeup means tension that can impose on the structures that reside within. These are your intestines in the back, your ovaries and uterus, or your prostate in the middle, your bladder in the front. There are obviously muscles, tendons, joints. Then there is arteries, veins, and nerves. So when this area becomes tighter because the muscles are thicker, they impose on those structures, and everything I named there is going to be a fair game to manifest some kind of a symptom. Some of the telltale signs that I see from patients' history when they're here with pelvic floor dysfunction is some of the things that we don't necessarily associate with pelvic floor dysfunction: a chronic lower back pain, chronic SI joint pain, chronic hip pain or groin pain, or hip mobility issues, lower extremity issues, when they suck their tummy in or they hold their breath. That's a good one. When they are clenching their butt or they squeeze the anus, the anal sphincter. When they stand on one leg instead of two. When they dribble when they pee. When they have to push to urinate. These are all different things that people tell me that my brain translates into what structure and what path is this individual's body going through for that function to take place. Standing on one leg is a huge deal, and we do it a lot. So why is it that standing on one leg is more comfortable than standing on both legs? Why is it that this individual, when I ask them to walk, because I evaluate their gait, they clench their butt, and instead of flowing forward in walking, they kind of shove and tuck their tailbone under them to push themselves forward? Why are they clenching their butts so much? Why is it that they're hitting the ground with that heel so much? Why am I hearing the heel strike so much? These are all things that when it comes to pelvic floor dysfunction, when we think the solution is finger up the vagina or anus, gets missed. We're looking at the breathing. How is this individual breathing? Because believe it or not, your breathing, your biological breathing, not your version of breathing, is your chance of these muscles getting the relaxation from breathing in and the contraction from breathing out. That's biological breathing. If you don't know what that's all about, that just means you haven't subscribed to my channel, because you would have known by now. If you don't know it, my team's going to put that video at the end of this video, but please make sure you subscribe to the channel. I think I have thousands of videos on YouTube channel, and my whole goal is to educate you on the things that you're not thinking about. At the end of the day, your body's only chance of succeeding is your awareness, and you're implementing the knowledge onto everything that you do going forward, anything and everything you touch. So back to pelvic floor dysfunction. What we want to do here is we want to bring stability into the picture. So there's a lot of things that happen. So those are just mentioned some of the things that I do when I'm listening to my patients, some of the things I evaluate. I want to know, is this trunk, the part of your body that's covered by a gymnastic leotard, is it able to stabilize and stay stabilized as this individual is going from point A to B? What's saying let's move forward? A lot of times it's the butt clenching that says let's go forward. Sometimes it's the upper quadrant that says go forward. It's just that these are all compensation patterns that are taking place, and compensation patterns are the reason why we live as long as we live. We don't die when there's a deviation from the ideal. We compensate, and when we compensate over time, we end up hurting ourselves, but we're still living. I use developmental exercises, the same exercises we all did as babies, to become running toddlers. In fact, without you and I knowing each other, we've followed the same path. No bands, no gyms, no weights, no instruction or guidance, and yet we followed the same thing. Our brains know exactly what that is, and our body parts know exactly what their role is. That is the manual of movement. So we use the manual to see where the problem lies, and we fix that problem by the patient or the client to understand what right looks like, what wrong or their version looks like, and how to replace theirs with the right. Without stability, it's like driving on ice. Strength is not going to materialize if you don't have proper mechanics in place. As a baby, you didn't lift weight, but you use your body the proper way. There were certain principles that you followed no matter what. And you built strength over and over by building the mechanics and working on that positive neuroplasticity there. So let's talk about some of the exercises that I find absolutely foundational to you having a chance to work on your pelvic floor instability, pelvic floor dysfunction, and pelvic instability. I already mentioned biological breathing, so that's a given. That's how you should be breathing anyway. So make sure that when you watch this video, at the end of this video, you really take it to your heart. You practice it every day. I suggest to my patients to practice 3 right biological breathing in the morning before starting the day, and at night before going to bed. The next thing that we're going to be doing is what's called toe tapping. So I'm going to show you the toe tapping. Then I'm going to show you my favorite, which is single leg stand. And then there's a single leg bear. So let's begin. The first one is toe tapping. So what we're going to do is I'm going to go ahead and lay down on my back. The small of your back is closed. You are going to rotate the pelvis to close that gap. You're not clenching your butt. You're not shoving your pelvis up. You're rotating the pelvis to close the gap. Then you're going to bring one leg up. And when you're about to bring the other leg up, you want to make sure that your body doesn't migrate downward. So you bring that up and you hold. Your legs are not going south. Your legs are at about 85-degree flexion. Your hip is at that degree, and you're flexing your ankles and you're holding up your arms like you're holding a big teddy bear. Not up here, but there. And then you're going to go tap the ground, flex your ankle, and come back up. Extend your ankle, tap the ground, flex, and come back up. You are stabilizing the front of your body with the back of your body, which is absolutely necessary for your pelvis to have a chance of stability. So that's one. The next one I'm going to show you is the single leg bear. What you're going to do is you're going to go into quadruped. By the way, if you haven't subscribed to the channel, make sure you do, because I've done videos on this. Like, I don't know, I have thousands of videos here. So what you want to do maybe is you want to search my channel, look for quadruped. So things are going to show up showing you what quadruped is, because the single leg bear is an offshoot of quadruped, which I'm not going to show you here just because the video is going to be way too long. So you're going to go on all four. You're not locking your elbows. Your spine's nice and neutral, meaning you're not arching your back or curving it this way. You're going to go on your toes, push the ground away, and get yourself up into this position. You want to be able to balance yourself between the hands and the feet, and without shifting your whole body to the right or left, or dropping the lower part of your trunk up or down. You're going to lift one foot up, bring it down, do the next. These are not difficult exercises because you're lifting so much weight, but they're challenging exercises because you're trying to build the mechanics. The next one is my favorite, only I'm partial, only because when I shattered my pelvis, I had a hard time really balancing my pelvis. And I was just semi-devastated over the results that I was seeing because I wasn't able to do the things I like to do. And believe it or not, this is the reason why I'm so passionate about pelvic floor dysfunction and what I do. So this one is a single leg stand. So we're going to go ahead and stand up and do this exercise. Oops. You're going to stand up nice. Can you see me all right? So we can go back maybe. So what's going to happen here, you can't. Can you turn that up a little bit? Okay, good. So you're going to stand just like your feet are as wide apart as the center of your pelvis. So if this is my groin, the center, not pelvis, the groin. The center of my groin is right there. It lines up with my knees and with my ankles. What I'm going to do is I want to keep everything on one leg and then lift the other leg up. What you don't want to do is shifting to the side like so to bring that up. So you don't want to be doing this to get that up. We want to engage our IT band and glute med to really control the positioning of our pelvis instead of shifting it to the right and left. We're also wanting our inner thigh to work with the outer side of the leg to stabilize me in place. We're using our feet nice and firmly in place, and then we're lifting one leg up. You hold it until your ankles are like all wobbly, then switch, go to the other side. Now, it took me a while to be able to do this. And the reason is because I didn't have pelvic stability. So I was doing so much of that side shift, and my knees had a hard time even knowing what to do. But once I was able to do this repeatedly is when I started seeing the change. So the reason I'm showing these things is because your problem may seem to be complex. It is a complex issue, but it doesn't have to be so complicated. Your body parts want to serve you. That's a given fact. Provide the environment that they're familiar with and they shine at. And next thing you know, you're in a much better place. Make sure you subscribe to my channel. Make sure you follow me here. If you have any questions, comment below. If you need to see me, use one of the methods of contact in the description box to contact me. Have fun. See you next time.